Welcome to our family. We are so excited to start this journey with you. Let's go over together on some instructions and tips to make this experience the most amazing possible. Keeping your braces clean remains the number one thing you can do to ensure a dazzling smile. The key to cleaning your teeth is not about brushing harder, but about spending a little bit more time in a more thorough technique. When brushing your top teeth, angle the toothbrush so the bristles are aiming towards your gums. Place the bristles above the braces using a soft circular motion and clean all your top teeth. Keeping the brush at the same angle, place the bristles between the edges of your top teeth and the braces. Now brush your teeth again with the soft circular motion. Repeat both steps on your bottom teeth. Most plaque will collect around your braces as well as the area between the braces and gum tissue. Within 24 hours, this plaque will begin to change the enamel of your teeth. If you do not brush correctly, a white spot can form on your teeth. Over time this can fade, but the damage of the enamel is hard to reverse. Make sure you spend at least 2 minutes twice a day brushing. Also, it is common to naturally brush one side more than the other. Please ensure you brush every tooth completely. Flossing is also a very important part of keeping your teeth clean. Special floss used for braces is called super floss, or you could use platypus flossers. Super floss has 3 parts to the floss. The first part helps get under the wire. The second helps to clean around the brackets, and the third part is used for regular flossing. Be sure you use the super floss or the platypus flossers at least once a day. Mild discomfort can be a normal part of orthodontic treatment. If a brace or wire is rubbing against your lip, dry the area with a Kleenex or napkin, pinch off a small piece of the provided wax, and press it on the brace that is rubbing. Wax also works well when you have a small amount of wire that may be poking your cheek. At times Dr. Morgan will use small wires to hold the main wire on your braces. If an edge of the tying wire is irritating your lip, you can gently push it under the wire using the eraser of a pencil. Sometimes a brace may come loose from your tooth. If the wire is not poking you, you do not have to consider this an orthodontic emergency. The brace remains attached to your wire by the way of the colored tie or tying wire. Although this brace may feel different from your other braces, it is doing no harm to your teeth. Dr. Morgan will evaluate this tooth at your next scheduled appointment to determine whether you need to replace the loose bracket. You will want to contact your office and a former staff member that you have a bracket off, and the doctor will assess what to do at your next appointment. Another great new way to get rid of normal orthodontic soreness is the new technology of the Dental Comfort Wand. This was a new invention introduced in 2022 that helps to modulate the nerve response in the mouth without any side effects of typical numbing medication. Dr. Morgan can use this in the office, but more exciting is the take-home units that you can get to help alleviate any discomfort you have at home. Let us know if you are interested in taking one home. Now that you have braces, there are a few foods you need to avoid, but most foods you can still eat, just in a different way. Foods to avoid are hard or sticky. Some examples are caramel, taffy, gum, etc. These foods can break brackets and cause wires to bend the wrong way, which is not good for teeth movement. Foods to modify: cut meat off the bone, cut corn off the cob, and cook hard vegetables until they are soft enough to eat. Other foods to watch out for: when choosing something to eat, be smart about it. Popcorn is fine, but do not chew on the kernels. They are hard and can break brackets. Vegetables are great for your diet, but make sure they are cooked or cut into very small pieces if they are hard when raw, like carrots or broccoli. Food is not the only hazard. Chewing on pens or fingernails can break brackets as well. All these things delay treatment. Last of all, if you ever have a true dental emergency, first call 911 and then call Dr. Morgan on our office voicemail after hours. I hope these tips have addressed your orthodontic concerns. If you still have a question, don't hesitate to contact our office.